So I promised that I would either come back and do a live or do a video on supplements. So I wanted to talk about supplements today. And for those of you who don't know me, if you're new here, hello, thanks for joining. I am Dr. Kelli Ritter. My doctorate is actually in counseling. I have over 25 years in clinical mental health, and then became a nutritional therapist in 2019. So I have transitioned to doing all mental health nutrition, specializing in anxiety and also depression and mood. So, so I wanted to talk a little bit about supplements, not just in terms of mental health nutrition, but in general, kind of. I'm a nutritional therapist, so of course I like targeted supplementation. I really enjoyed my training in nutritional therapy. We did functional nutritional therapy training. So we utilized supplements and food and even water to test different functions in the body, different systems. And I loved doing that. And I think it's very helpful for people to be able to use supplements in a very targeted way. That being said, some of you already know, I believe that you do not have to use supplements in order to heal. In fact, if you're like me and you've got drawers full of all these supplements that you take for a while and then you don't, it's absolutely fine if you want to just work on your food and use sun or light therapy using the sunshine, oxygen, and food. That's what your mitochondria need, and that is absolutely perfectly fine. There are some supplements that might be helpful as you work your way there. So, and you can't supplement your way out of a poor diet. Most of you know, you've heard me say that a lot. That's what I learned in my nutritional therapy training, and I repeat it all the time, that you really want to be getting your nutrients from your food. But some of us have trouble absorbing those nutrients. We have digestion, issues with digestion. And so it's helpful if you want to start by helping those systems out and by using some supplements. So I will say, the basics. Well, let me talk about in this way. Maybe this will be helpful. I heard Dr. Stephanie Remke talked about health on a spectrum from 0 to 10. And I think this is helpful. 0 being can't get off the sofa, can't get out of bed, feeling really, really horrible, having chronic illness of some sort or some kind of pain or mental health issues. And so you're really on the lower end of 0, 1, 2, really feeling pretty horrible. And then 10 being vibrantly healthy. You have all the energy that you need to do whatever it is that you do during the day. Your digestion is good, your mood is good. And by good, I mean stable, appropriate for what's happening. You wouldn't want to be laughing while something sad is happening, but that you feel like you are appropriately feeling what makes sense for what's happening in your world, but also able to meet life on life's terms. And that can sometimes be challenging, but you want to be able to feel pretty good most of the time. And I do look at digestion, mood, and energy. So that's what I have my clients when you're first kind of starting out is paying attention. Remember that mood follows food. So every time you eat anything, even before you eat, noticing like, how are you feeling? Are you in a rest and digest state? Are you in a stressed state? See if you can get into a rest and digest parasympathetic state before you're going to shove food in your mouth. But paying attention after you eat, 10 or 15 minutes after you eat, how's your digestion? Then notice how your energy is for the rest of before the next time that you eat, and watch your mood, because mood follows food. So if you are a 0, 1, 2 on that spectrum, then you're probably going to need some just good basic kind of nutrients as you're starting to figure out your way of eating that's going to be best for your healing. As most of you know, or maybe you don't know, I am an advocate for an animal-based diet. And I am animal-based because that's where I see the most healing. And of course, I'm after essential amino acids and essential fatty acids because that's where you're going to see the most improvement in your mental health as well. I think overall health, but we'll just stay in my lane and talk about mental health for a second. So I'm going to want you to have some good building blocks of those amino acids because those amino acids are the building blocks to your neurotransmitters. So while you're kind of figuring out which foods feel like medicine in your body, what seems to really fuel you, and then what seems to feel like poison in your body. So as we're learning how to use food as medicine in your body, we're probably going to want to use some essential fatty acids. So a good fish oil and a good, I'm not actually a big fan of multivitamins, to believe it, to believe it or not. I'm just not, but I think it can be really helpful if you are not eating much, you're not eating well, you're trying to figure things out, and you really just need some good nutrients in you. Or if you're an addict and in recovery, I mean, I think a good multivitamin, a good fish oil, and most of my clients are deficient in magnesium. You find that a lot. A lot of people are deficient in magnesium, but particularly in mental health. So just adding some magnesium. I like magnesium mineral spray because I think it's best absorbed through the skin. But there are lots of great ways to get these different supplements. So magnesium, and then also digestion, because usually where there are mental health concerns or mood issues, there are digestive issues. And so we really try to help people. I try to help people with those kind of basics: digestion, a whole foods diet to start, and then starting to notice how you feel with that, hydration, mineral balance, fatty acids, essential fatty acids, and then I add essential amino acids because I think they're lifesavers. So while you're figuring out how to get that from food, you can get that from supplements. So you can do some testing to figure out, and I think that's perfectly reasonable to do, blood work or hair mineral analysis. I have my hair mineral analysis done by my friend Michelle Best, who is wonderful. Salt Wellness is the name of her company. I will link her info below, and she's wonderful. So you can find somebody that does that testing. I usually use blood work and some urine testing because with anxiety, you want to rule out pyroluria and some other things like that. So you can do testing, but you can also just start with the basics. And then once you get to about a 5 or 6, so if you're already at 5, 6, 7 in terms of that 0 to 10 health spectrum, then you have a lot more room because you're already feeling okay enough. Because if we start doing it's kind of like in trauma work. As a trauma therapist for many years, we can't start tearing things apart before we kind of build you up. You want to build the container. So if somebody is really at a 0, 1, 2 with their mental health, with their health in general, we got to build you up to a 5, 6. So then we can start doing some more radical health kinds of things, and you won't feel horrible. You might drop down to like a 4 for a little bit, but you're going on your way to a 10, if that makes sense. And thank you, Stephanie Rimka, for teaching me to talk about it that way. But in terms of doing more targeted supplementation for mental health, I'm going to look at amino acids and essential fatty acids, and I'm going to want to make sure that you're like a 5, 6 before we really start playing with some of the other supplements that you might need. Once your vitamin D level, I do check vitamin D. I think it's crucial to our health. It's the master hormone. So we want to make sure that you're at a therapeutic level with your vitamin D. And once you're there, then I usually add B vitamins, but only if you need them. And Bs are tricky because there's no really good information on dosing So we have to kind of play with that, but only for 3 months. So the basics I like to do for about 3 months, some digestive help, maybe some magnesium, fish oil, maybe a multi. You kind of have to see how you do with those. And then as you kind of move for about 3 months or so, 3 to 6 months, you might end up staying on some supplements. For instance, if you have pyroluria, which is cryptopyrroles in your urine, that's actually a genetic condition. And so the body, the heme, it's a condition of the heme, but the body uses up zinc and B6, so you become deficient. So that's something that you're probably going to supplement longer term. And amino acids, we sometimes do longer term, 4 to 6 months, and then we see. But some people are going to need a lot longer than that. And that is perfectly fine as long as those supplements are helping. What I don't want people to do is I don't want your body to get dependent on the supplements and not doing some of the work. Your body's made to heal. So we just want to give it the raw materials to be able to do that. And in my opinion, the shortest amount of time to do that. So hopefully this information has been somewhat helpful. You can always, I have information on my website that I hope is helpful for people. And I also have a dispensary. I use Full Script. You're welcome to use that, or find a local store that you like, and they always have really good people that work there that can help you at a supplement store. And then unfortunately the rest is trial and error, just figuring it out. So hopefully that's helpful to you. Thanks for tuning in, and let me know in comments if you have any other questions.